Hello, everyone. Thank you so much for joining me today for this webinar. My name is Dr. Sarv Varta Khalsa, and I'm going to be talking today about low-dose naltrexone. So I have been in practice for a little bit over 20 years, which is amazing to me. Time flies. 6 of those have been here at Living Wellness Medical Center, which I love. And all of the doctors here, we kind of rotate through and we offer monthly webinars. And this month is my month. So I'm really excited to be talking about this topic. This is something that I use a lot in my practice with my patients. And so before we dive into the material for today, I just wanted to sort of make a comment about the fact that low-dose naltrexone is a medication. And so you might be wondering, well, I thought naturopathic physicians tried to not use medications, and try to get people off of medications, which is definitely true. But there is a time and a place, and also, specific ways that you can use medications in a way that really actually supports the body in its healing rather than forcing it to do something. Typical medications, it's sort of like using a sledgehammer to, force your body to have a particular effect occur. And with that, a lot of times, unfortunately, there are side effects that occur because of that. And so that's why we try to steer clear of medications as much as possible, especially because we have so many wonderful natural alternatives. But low-dose naltrexone is one of those medications that is used in a different way. And I'll talk a lot about that during the webinar today and explain exactly how it works and how it's utilized. But with that said, also, as naturopathic physicians, we like to have a very large toolbox. And we do have a very large toolbox, which is one of the advantages, I think, of naturopathic medicine. We have so many wonderful treatments to pull from and draw from when we're treating our patients. And so it's just one more tool in our toolbox that can be utilized very, very effectively. So, with naturopathic medicine, it's not so much what you use, but how you use it. And so really how we use our treatments is based on a philosophy. And so I thought it would be kind of interesting and worthwhile to just very briefly and quickly go over the underlying philosophy of naturopathic medicine and what makes naturopathic physicians different from conventional medical doctors. And like I said, it's of course what we use, but it's not even as much what we use, but how we use it, and also our philosophy. So I'm just going to go through the 6 basic tenets of naturopathic medicine, and then we'll jump right into the material. So first, do no harm. That is, of course, extremely important. And we utilize the most natural, least invasive, least toxic therapies as possible. And definitely low-dose naltrexone falls into that category. The healing power of nature. Naturopathic doctors recognize and harness the body's inherent wisdom to heal itself, which is amazing. I love it. In order to guide our patients to wellness. We identify and treat the cause. So we're not just slapping a Band-Aid on it and treating the symptoms. We try to identify the underlying causes of illness and remove any obstacles to cure. Doctor as teacher. I really love this tenet of naturopathic medicine, and I do it every day in my practice. It's really, really important, I feel, to educate my patients about their health and about, I always make sure that they understand why I'm recommending certain treatments and therapies. It's really, it's a relationship. It's not just me telling them what to do. So it's important for them to understand why they're doing certain things. So through education and a trust-based relationship, patients can better understand the steps that they need to take in order to achieve and maintain their health. And that includes diet and lifestyle, as well as supplements, treatments, everything like that. We treat the whole person. That's really important. Naturopathic doctors understand the interconnectedness of our body, our environment, our lifestyle. All of these things impact our health. And so we are, very thorough with our intakes. And so, we're talking about social issues and, mental, emotional, as well as physical symptoms. Prevention. We are very good at prevention. That is kind of our strong point, right? Naturopathic physicians really focus on that. And so naturopathic medicine affirms that it's better to prevent illness whenever possible rather than treat it once it occurs. Of course, we do both. But if you can prevent something from occurring, for example, maybe somebody has prediabetes and you want to prevent them from going down that road of actually getting diabetes, we can do that. And it's nice to be able to catch it early enough before any damage has occurred in the body that's maybe more permanent. So anyway, those are the principles. That is the philosophy of naturopathic medicine. And I just, it's not something we talk about every day, but just, I think it's important to understand that that is always our foundation when we are treating our patients. So, okay, let's jump right in. So in order to talk about low-dose naltrexone, we need to talk about what is naltrexone. And so naltrexone is a medication that was approved by the FDA in 1984 in a dose of 50 to 100 milligrams to help people with either heroin, opium, or alcohol addiction. It helps get them off those things. And so it helps them get off of these drugs with fewer side effects, increases their chances for success. And basically, what these drugs do is they inhibit the effect of those kind of opioid drugs by blocking the opioid receptors. And so we call them opioid antagonists. And so they basically, when they block those receptors, it prevents that feeling of euphoria and sort of the high that they would get in using those drugs. And so there's really no reward in using it. And so hopefully they desire it less and they're able to, kind of get off of those drugs. So that is how naltrexone has historically been used. So what is low-dose naltrexone? Basically, low-dose naltrexone is using doses of naltrexone that are about 1/10 the normal dose of 50 milligrams, and very often even a little bit less than that. So typical doses of LDN, we call it LDN for short. It's a lot easier to say. So typical doses of LDN are 1.5 to 4.5 milligrams per day. It can be lower, it can be higher, but that's pretty standard. And it's typically taken before bed, but it can be taken in the morning as well. So a little bit of history. Low-dose naltrexone is very well researched, and over the past 30 years or so, more and more research has come out in terms of different conditions that can be treated with LDN. And just, learning more and more about how it actually works and things like that. And so it has become kind of much more mainstream. I mean, I wouldn't consider it mainstream in the conventional medical system, but certainly most naturopathic physicians, functional medicine doctors are aware of LDN, and, many use LDN in their practice with their patients. So in 1981, Dr. Patricia McLaughlin and Dr. Ian Zagon at Penn State University began researching and then later published results on the use of small doses of naltrexone to slow down tumor growth in animals. And I'll get to it in a minute, but that is actually one of the indications for treatment with LDN is cancer. So, and then in 1984, naltrexone was approved by the FDA for treatment of opioid addiction at doses of 50 to 100 milligrams, like I mentioned. In 1985, Dr. Bernard Bihari, a physician in New York City, discovered the effects of low-dose naltrexone, and he was using about 3 milligrams a day. He started to notice effects on the immune system in humans. Some of these were animal studies, some humans. And then in the mid-1990s, Dr. Bihari noticed that patients in his practice with cancer, such as lymphoma or pancreatic cancer, could benefit in some cases really dramatically by taking LDN. So a lot of this was observation, and eventually more and more research and human studies have been done. But it's kind of interesting. The beginnings of it was a lot of observation. He also observed that people who had an autoimmune disease like lupus often showed improvement while taking LDN. So he was definitely doing some experimenting with his patients. So how does LDN work? So opioid receptors are found in the nervous system, and they're embedded in the outer membrane of the nerve cells. So when opioids bind to those receptors, it triggers a series of chemical changes that leads to feelings of pleasure and also pain relief. So that's why people like them. And that's kind of how LDN works, but in a slightly different way. So drugs like morphine, heroin, and fentanyl bind to the opioid receptors and cause a surge of a pleasurable sensation, or a rush, they call it, right? Lowdose naltrexone is also an antagonist of the opioid receptors, meaning that they bind to those receptors and block those receptors. And what this causes is an upregulation of your natural endorphins. Your endorphins are your feel-good chemicals, right? And so endorphins create happy feelings, they help to relieve pain, and they reduce inflammation. And it also has an effect, that affects the immune system as well. So low-dose naltrexone decreases autoimmunity. That is, I would say in my practice, the number one reason why I prescribe LDN. But it can also be prescribed for pain or inflammation and other things, which I'll get to in just a minute. So what dosages are typically used? So first of all, LDN is prepared by a compounding pharmacy, and it does require a prescription. And so you really, because you're ordering it through a compounding pharmacy, you can really individualize the dose. So, if I have a really sensitive patient that doesn't tolerate kind of the standard dose, we can start really low and very, slowly titrate up to their tolerance. And so that's kind of nice that it's compounded, because you can individualize it to your patient. So it can be used in doses of 0.001 milligrams. That's called microdosing. I don't have any experience doing microdosing, but I know that it is a thing, and some people do that. And then all the way up to 16 milligrams. I have never used doses that high. The highest that I've done is 4.5 milligrams. So that's the most common dosage used, is 4.5 milligrams a day. So, and then I will typically titrate it up rather than starting with the 4.5. I've had a few patients that really just want to go for the 4.5 and do that right away. And if it's a patient that I know is not very sensitive and I think they'll do okay with it, I'm okay with just going with the 4.5 initially. But most of the time I titrate up. And so what that means is that I will start with a 1.5 milligram capsule, and they'll take one capsule a day for anywhere from 7 to 14 days, and that's individualized based on the patient. And then they will increase to 2 capsules, which is 3 milligrams per day, for 7 to 14 days. And then they'll go up to 3 capsules, which is 4.5 milligrams, and then take that for 7 to 14 days. And if my patient's doing well with that dose, then I will change the dose to 4.5 milligrams per cap, so that they only have to take 1 cap per day instead of 3. And I definitely have had a handful of patients that just didn't tolerate going up to 4.5 milligrams, and they did, better with 1.5 or with 3. Usually it's more like we land on 3. But generally it's so well tolerated. But like I said, some people are sensitive, and so we can do whatever dose is appropriate for that particular patient, and it still will be effective, even if you're not up all the way up to the 4.5 milligram dose. So what can it be used for? What health conditions? So as I mentioned, it is definitely most commonly used for autoimmune conditions. Hashimoto's thyroiditis. This is the number one thing that I prescribe it for, and it's very helpful. I have also prescribed it for rheumatoid arthritis. It can be used in the treatment of lupus, Crohn's disease, psoriasis. These are all autoimmune conditions. It can also be helpful in people that have fibromyalgia because it does have that pain relief element to it. And of course, people with fibromyalgia have a lot of muscle pain. So it can be helpful with that, as well as chronic fatigue syndrome. So for people that have that particular condition, it can actually help to boost energy. And also just people that take LDN that maybe don't have chronic fatigue syndrome, they sometimes notice an improvement with their energy. And then, of course, cancer. I don't treat cancer patients personally in my practice, but I know that it is used extensively in, with doctors that treat patients with cancer. Other conditions that can be treated by LDN, those are kind of the most common, but others on the list: depression, ulcerative colitis, irritable bowel syndrome, multiple sclerosis, diabetic neuropathy, interstitial cystitis, which is like an irritation of the bladder, like a chronic irritation of the bladder that's not caused by an infection. Mast cell activation syndrome, which is like hives, basically. That's part of it. It's just sort of this allergic syndrome. And then importantly, long COVID or a reaction to the COVID vaccine. So low-dose naltrexone, one of the effects that I mentioned it has in the body is that it's anti-inflammatory. And so a lot of times with people that have long COVID or they have some sort of reaction to the COVID vaccine, there's an element of inflammation happening there, and part of that is with the spike proteins, and there are many, many things that can be used to help treat these conditions. Especially long COVID, it's pretty complex sometimes treating long COVID and people that have this. It might be a little bit different in each individual person, why they have long COVID. And so, but there are lots of different treatments that have shown to be very helpful and effective. And so I have treated patients with long COVID and definitely also patients that have had a bad effect or a bad reaction after the COVID vaccine. And so not necessarily talking about the short-term immediate reaction right after that lasts a day or two. That's not fun, but I'm talking about sometimes people develop chronic health issues after the COVID vaccine. I've seen that quite a bit in my practice. So LDN is one of the things that I have found very helpful. So is LDN safe? The short answer is yes, it's very safe. LDN is very well researched and it is considered safe. And it's generally very well tolerated. I'll have a patient or two that might have some unusual symptom with it, or just like I said, needs to take it a little slower. But generally, people tolerate it very, very well. The most common side effect is vivid dreams or insomnia. And this is easily remedied by just taking it in the morning rather than taking it at night before bed. And it works just as well. So what are contraindications for LDN? Really the main one is, so LDN blocks opioid receptors. So patients should not be taking LDN if they are taking opioid agonists, and it's the opposite of an antagonist, where it actually stimulates that opioid response. And that's what those medications do. And such as narcotic pain medications. And the reason is because it can potentially decrease the effectiveness of those pain medicines. And you might, because of that, have more pain if you have a serious pain condition. So medications like hydrocodone, oxycodone, codeine, fentanyl, tramadol, those are contraindications. And, if I do have a patient that is taking one of those medications, and they really want to do LDN for a particular reason, maybe they have an autoimmune condition or something, I will at least have them space it apart as much as possible. So they might take their LDN before bed and they take their other medication in the morning or something like that. You just don't want to take them directly together for obvious reasons. You don't want to be blocking those receptors. So full dose naltrexone at a dose of 50 milligrams does carry a cautionary warning against its use in those with liver disease. However, that does not apply to low-dose naltrexone. It is such a small dose. It does not affect the liver in a negative way at all. I've never seen that. So that's a good thing. So how do you get a prescription for LDN? You would consult with your naturopathic doctor or your healthcare practitioner. Like I said, most conventional medical doctors either don't know about LDN, or maybe they're not comfortable prescribing it for whatever reason, because they don't learn about it in their training. And so anyway, but you can definitely consult with your naturopathic doctor, and I think most will know how to prescribe it and know about it. So that they will then send a prescription to a compounding pharmacy. And it's not available at local pharmacies like Walgreens or CVS. And that kind of tells you a little bit about it too. It's sort of an out-of-box use. And so it's not a standard medication that's used in mainstream medicine. And it's not covered by insurance. So really anything prescribed through a compounding pharmacy is typically not covered by insurance. So even like bioidentical hormones and things like that. But what's nice about using a compounding pharmacy is that you can individualize your dosages and things like that. And of course, you can have access to a lot of things that you wouldn't have access to in a regular pharmacy, like low-dose naltrexone. So what is the cost of LDN? So it varies depending on the compounding pharmacy that you use, but average is about $1 per day. And so it might be a little bit more in the beginning when you're titrating up, because a lot of compounding pharmacists will charge based on the number of capsules rather than the dosage, and a little bit difference with the dosage, but more with the number of capsules. So you're taking more capsules. So a little bit at first, but then once you're on the single capsule a day of 4.5 milligrams, it's about $1 a day, so $30 a month. So really pretty inexpensive. It's really very reasonable. So in summary, low-dose naltrexone is a unique and very effective treatment for autoimmune conditions and pain and inflammation. And it's very safe and well tolerated. And so I would encourage you to discuss it with your doctor and see if you could benefit from taking LDN. If you have a particular condition that I've talked about today, or just wondering more about it, you should talk to your doctor. So, and all of the doctors here at Living Wellness Medical Center, we offer a free 10-minute meet and greet. So if you just wanted to chat a little bit about whatever health conditions you're wanting to treat, or if you have questions about LDN, maybe if it's a good treatment for you, you can give us a call. This is our contact information here. At Living Wellness Medical Center. Feel free to check out our website. We have lots of great information on our website, and just stay in touch. So, and then, as I said, we offer these webinars once a month. So tune in for next month's webinar. All right. So at this point, I'm going to open it up to questions, and I have a little chat open here on the side. So if you have any questions about the material today, feel free to just type it in the chat, and I will answer any questions that you have. I don't see any so far, but one of the things, I kind of thought of some questions also that, patients sometimes will ask me. One is low-dose naltrexone addictive? And the answer is no, it is not at all addictive. And so there's no concern, no worry about that, even though we hear the word opioid and it's like, oh my gosh, opioids are addictive. So no, it's totally different and is not addictive. So it looks like Ralna says, I have a statement. I have a testimony. Maybe you could expand on that a little bit. I'm not sure what you mean by that. Maybe it's that you've used it and you have a story to tell. Sue is asking, would LDN be a preventative medicine for cancer? That's a really good question. I suppose it could be used that way. I haven't necessarily used it as a preventative measure, but since it does alter and slow down tumor growth, if like theoretically, I suppose if you had a tumor, it could help with that. But I have not specifically used it that way. Another question, are there other drugs like LDN that are used to treat similar conditions? Well, I mean, yes, there are many different ways that you can treat autoimmune conditions, for example. So Hashimoto's thyroiditis, for example, we want to definitely work on getting the thyroid as balanced as possible, make sure if they are on medication, it's the right dosage. And then we can also do some things to help decrease the autoimmunity outside of LDN. That's, not every single one of my patients uses LDN. And really that comes down to decreasing that autoimmune reactivity in your body. And, part of that is going back to the source of your immune system, which is your gut. About 70% of our immune system is in the gut, in your digestive system. And so it's really, really important to support gut function and digestion with probiotics, gut repair if needed, test for food sensitivities, whatever the case might be. Those things are really important. And yes, there are other natural therapies that we can use to help decrease autoimmunity. And then with Hashimoto specifically, a gluten-free diet is very important and very helpful. So yes, I mean, once again, as naturopathic physicians, we're most of the time using multiple tools to help people with, to get back to health. So let's see. Let's see. Oh, okay. So Rana's giving more information. This is great. So anyway, Arlene, hopefully that answers your question. So Rana says that it sounds like she took it for Crohn's disease and no longer has any symptoms or signs of Crohn's. Treated by Mayo, they were stunned. Okay, so you probably went to Mayo, they diagnosed you, maybe you saw a naturopathic doctor or somebody that prescribed Lowdose Naltrexone for you. And since May of 2015, sounds like you haven't had any signs of Crohn's, which is amazing. Congratulations. I love hearing stories like that. And it also sounds like, you're paying $25 a month with no side effects. So that's kind of the average, 25, 30, depending on the pharmacy that you use. And then that's great. Thank you for sharing that, Rona. I'm so glad that you had such a great response to it. Jamie is asking, have you seen LDN to help quit smoking? No, I haven't. That's an interesting concept. And then let's see, Rona's also saying something about Humira they cannot describe. You might expand on that a little bit, Rona, I'm not sure. So maybe you were taking Humira. Not Mayo, they can't prescribe it. They can't prescribe the LDN, I think is what you're saying. Yeah. And, as I mentioned before, I would consider it pretty unusual for a conventional medical doctor to prescribe LDN. But as naturopathic physicians, we do it a lot. I utilize that a lot for patients in my practice. And I know the other doctors here do as well. Let's see. And then another question that I get a lot is, how long do I take the low-dose naltrexone? And that definitely is individual, based on maybe how my patient responds to it and that sort of thing. But typically it's long-term. And so it's recommended definitely for a minimum of 3 months to really see what kind of benefit you're going to receive from it. But usually it's longer than that, 6 months, a year, or even longer. Some people just take it for years because it helps them a lot and they just do better and feel better with it. And there's no problem with taking it long term. Let's see. Anne is asking, do you have this session taped, and where could we share it? So these webinars are recorded and then they will be on our website. It usually takes a couple weeks for it to show up on our website, but it will be there. And there's also an article, just a brief article on our website already that I wrote a number of years ago on LDN that just kind of has some of the basic information I presented here. But yes, this session is taped and you can access it through our website. Just give it a little time. Oh, okay. Ron is saying you took Humira and then you switched to LDN and you've done really well with it. That's great. Jamie's asking, how long should it take? Should I take it in order to see results? Yes, that's a good question. And so, yeah, at least 3 months, and usually longer. And not to say that you can't notice improvement even earlier than 3 months, but it does typically take some time for the effect to kick in. And so I always recommend at least 3 months, sometimes 6 months, a year, depending on what we're treating. So yeah, you do want to give it time. All right. Any other questions? All right. I don't see any more. And, as I said, my contact information is here up on the screen. If you want to take a screenshot of that, if you have other questions that come up, reach out. You can reach out to us. Let's see. A couple other things coming up here. Jamie's asking, where on the website can we find the LDN articles? So on our website, we have a search option at the bottom of the homepage, and you can just type in LDN or Lowdose Naltrexone, and it will come up, and then you can click on it. Arlene, let's see, nortriotoline, the same. I'm not sure what that is. Sorry, Arlene, I'm not sure what that is. And then Rana's asking about ALS. Can it treat ALS? I would include ALS on the list of things because it is an autoimmune condition. We're learning more and more about ALS. My father actually passed away from ALS about 15 years ago. And there's, unfortunately, there are no true tried treatments that, are miraculous cures. Most people, unfortunately, with ALS will die from it at some point, often quickly within 2 years. Some people, somehow stick around, 10 years longer. Stephen Hawking's, like 30 years or something, which is amazing. But ALS is a very, very difficult condition to treat. And believe me, with my dad, I was actually a new graduate at that point. I was doing my residency, and I did tons of research and tried every single thing I could think of or do. I was giving him nutritional IVs every day, every week, and just you name it, I did it. And nothing really seemed to help, unfortunately. So ALS is definitely a very difficult condition to treat. But hey, why not? I think that LDN, it definitely falls in the category with ALS of couldn't hurt, could help. So, definitely a consideration. All right. Any other questions? All right. Well, I think I'll end things here. Thank you so much again for joining me today for this webinar. And hopefully I'll see you at the next one that I do. And as I said, tune in next month for our next webinar. Oh, you're welcome. Okay, just real quick. Let's see. Nortriptyline. effective blocking of pain. Okay. Yeah, just a totally different mechanism of action and different type of medication. LDN, I think, is just a safer, prescription for pain. So Arlene is asking about using nortriptyline and having the effective blocking of pain. I think you're asking maybe how it compares. Yeah, so LDN I would consider just very kind of more gentle. So hopefully that answers your question. So yeah, you're welcome, Sue. And thank you, Joanne. And so anyway, I hope you all have a wonderful rest of your day and a great weekend. And I will see you next time. Thank you so much. Bye-bye.